Welcome to India Shield. We are going through the COVID-19 pandemic that has gripped the world since March last year. It has become important that we pay attention to specific areas of healthcare challenges posed by these infectious diseases. The pandemic has majorly affected our ways of life, and let's not forget our little ones are vulnerable too. As parents, being as precautious and yet not pressing that panic button is too hard, and it's very, very important for us. I am Vishal Gondal, founder and CEO of Goki, and this is COVID and Child Healthcare with Dr. Nihar Parekh, a very, very well-known and special pediatrician and founder of Cheers Childcare. In this session, Dr. Nihar will address some very important questions related to COVID and our kids. He's going to talk about how vulnerable will be our children in the third wave. What must parents be mindful of with regards to our kids' health and habits during the pandemic? What should we know about vaccination? Important question in everybody's mind. And how should we educate our children about COVID-19? This is going to be followed by some questions which we'll be doing interactively with the audience, and you can send your questions on all the various social media networks to us. A little bit about Dr. Parekh. He's been in the field of pediatry for a long time, and he provides holistic and intensive childcare under one roof in Mumbai, South Mumbai's Kemp's Corner area. And he runs this very state-of-the-art facility called Cheers Childcare. So it's actually a much forward-looking concept of kids' health. For over 5 years, he has striven to set up an all-in-one affordable childcare, especially tapping into every aspect, right from birth up to 18 years. This includes a daycare, surgery, child mental health, well child, immunization, and more. So it's like a very, very interesting concept. And I think now, especially in this pandemic, it is important to see how innovation is happening across the world of healthcare, and especially with kids' health. So without further ado, it's over to you, Dr. Nihar. Would love to hear your opening remarks on this topic. Thank you.
Thanks, guys. Vishal, thank you so much for a lovely introduction. In the last a minute or two before we started this, it just proves what small world we live in and how closely parents are interconnected, connected to their pediatricians and connected to the healthcare of their children. So pediatric healthcare is something that is every parent's top to-do list. It tops their list because they want to provide for the best to their child. They want to make sure best in the form of prevention, best in the form of treatment, best in the form of the latest kind of testing required if and when there is something that's going to come up. So proactive care is catching up in our country. Pediatric care has always been very close to every parent's heart. They want to make sure the child is in good health. So hence it comes down to our responsibility to create an environment where we can be there for our patients, be there for the parents of their patients. And the concept of this clinic, Cheers Childcare, was to have an holistic care. And as time goes by, we realize that holistic care also involves parents' mental health and parents' peace of mind. So we cater to that as well in a form of being continuously available to make sure they don't press panic buttons unnecessarily. I want to take this opportunity to thank India Shield as well. It's a lovely initiative. It's spreading the right word. It's giving us an opportunity to calm parents down, but not shying them away or hiding facts from them. Giving the true facts, but giving the true essence of the facts, not what the essence is out there through the WhatsApp university, not the panic created by unnecessary media sort of pointers given, which is half information. Media does a great job, but it's always some important part left out to convey that sensationalism. So it's our job to calm everything down. So I have been given this opportunity to take a few initial minutes to talk about the topics you discussed, Vishal, the discussion about COVID in kids, the discussion of how the first wave was, how the second wave was, the possibility of a third wave. the immunization and the vaccinations that need to be taken care of with our children. COVID first came out exactly a year ago. We as pediatricians, observed the entire situation from, taking a back seat. We were very lucky. Our kids were very lucky. They didn't get affected in the first wave with the first virus attacking mainly people over 55, 60. A lot of us got infected, but the major people who suffered, the major age group that suffered was 55 to 60. And things started rolling, and we saw myself was sort of victim to a little bit of exposure. So went through the treatment myself, recovered well, like all young people were recovering. But as we carried on with the practice in the first wave last year, we realized that kids were not getting affected. Kids were coming to the clinic, they were coming less, we were getting less calls, there were not many symptoms. We were always worried about the parents calling us, the doc, we are sick, what's going to happen? And we should tell them, look, till now there is no information, and more than information, there is nothing evidential that tells us that, look, be careful, take care of your children. Yes, there were rumors and there were experiences, personal experiences of doctors, colleagues, ours, that children were carriers. So what used to happen was they had the virus harbored in them. They didn't have the symptoms. So it became more deadly because nobody knew they were harboring the virus. Parents would go up close, catch the virus, and they started falling prey to the disease. But again, as selfish as it sounds like a pediatrician, the kids were pretty safe. So we were not worried that much. And the wave got through, and people in November, December realized that, look, we are over COVID now. Things are looking better. Things started opening up. Jan, Feb, Goa, Maldives became the new hotspots of the world, and we were traveling to our bungalows, meeting our friends, socializing left, right, and center. A lot of us were still very cautious with the mask, but when kids meet, it's, haven't seen them in a while. I'm seeing my friends after a while. The masks used to come down. There were hugs and kisses, and bam. In Feb and March, the smart COVID virus decided to change its form, and the second mutation, B1617, now there's 0.1, 0.2, the virus became deadlier. Two things, Feb and March, the virus became deadly, smartly mutated itself, and we were lax. We were going out, lockdowns were not there were not much of social distancing being followed. Virus took this opportunity, and unfortunately, the second mutation, the second form of the virus, which was deadlier, really played havoc in the elderly, 55 to 60 plus, started playing havoc in the younger generation, 35, 40 plus. We had parents of our children, patients, getting admitted. We lost a couple of fathers and mothers of our patients, and it was absolutely heart-wrenching to see that people of our age were not only reaching the hospital, where were going on ventilators, were getting admitted in the ICUs, and some of them, unfortunately, were not recovering. Children then, and in March, we started getting calls left, right, and center. High-grade fevers in children, 102s, 103s. We started calling them to the clinic because these fevers were unremitting. They were lasting for more than 48 hours, and video calls, and it doesn't help in pediatrics. No child is going to sit in front of the camera and open the mouth where we can examine the throat. They just cry. They're uncomfortable. They don't want to sit in front of the video camera. So we started calling them to the clinic. We started seeing a particular pattern. Every child that we examined with a high fever used to have very classical symptoms of a pan-systemic virus. This jargon of pan-systemic means every system from head to toe was being affected. Headache, high fever, bloodshot red eyes, pain in the ears, typical blood spots on the back of the throat and the palate with severe throat ache. Few had swollen lymph nodes, cramps in the stomach, hyperacidic states, vomiting, loss of appetite, cramps in the stomach with loose motions, lot of loose motions, lot of gastros. But the most important symptom was high spiking, unremitting fever for 2 to 3 days. It was suddenly like a wave of patients of 15, 20, 30 kids every day. We started testing them because we could not document what was going. So RT-PCR started coming positive left, right, and center. And that's when we decided, look, this is the second wave and it's hit our kids. We were on the edge of our seats for a month because we didn't know how bad this virus was going to get in our children. So we started observing. we started following up. Our all phone lines were open 24/7, and we were encouraging our parents to keep talking to us and keep us posted, because we didn't know if this virus would cause that seventh day congestion of the chest that it caused in adults. We didn't know if this virus would make our patients go through CT scans. We didn't know this virus would send our patients to hospitals requiring oxygen and on ventilators. With God's grace, over the last 2.5 months of the second wave, we have till now not seen this in children. Children are still having the virus. The numbers have decreased as the virus has kind of lost the steam, but the children were maximum getting fevers lasting for between 3 days to 5 days. 2-day fevers were going, so we didn't need to see them. If the fever lasted for more than 2 days, we started calling them to the clinic. Third day, getting some blood tests done, documenting a viral, low counts, low platelets, little high CRPs, clinical examination, confirmed virus. No antivirals required, no remdesivirs, no ivermectins, no tocilizumabs, nothing was required. They were recovering well. Very few of them, I would say less than 3% of them, less than 5% of them had fevers lasting for more than 5 days. They started showing some hypercoagulation, that is thickening of blood, like it was seen in adults, but very well controlled in 3 to 5 days with IV fluids. And most of them, I think all of them, none of them required blood thinners. So we were very happy, and we are still very happy. We are happy that our children are okay. We are happy that they have picked up some form of infection, which I hope and pray in the future leads to antibodies forming in them. We started making parents aware of how to behave when their child had fever, because we were very worried about the child giving the infection to the parents, because once we were confident the child recovers in 3 to 5 days, we were more worried about the parents. Because in that whole act of love, on the day of fever, the parents would hug their child and sleep. They would be with their child without a mask on. And in next 5 days, the kid would be okay. But on the 6th day, the parent would reach the hospital. We had multiple cases. We started pushing the button that put your mask on the minute your child gets fever. We started giving examples of stuff they speak in the airline, that if there is a need of oxygen mask dropping, the first instruction given is what? To the parent. Put your mask on first, and then your child. We started, drilling it in their head, put your mask on, put your mask on. And I think we managed to do a great job with my colleagues and pediatricians across the city, because they realized that the virus in the child is not playing as much havoc as it has potential to play havoc in the parents. So they masked up, the grandparents maintained their distance, and hence the fall in the numbers. We are very happy, had a sigh of relief that things are going, there's light at the end of the tunnel as of now, and the second wave has come out pretty much non-dramatic for children. Third wave, a little panic 7-10 days ago in the media. Third wave is going to affect children more. Third wave is going to create more problems in children than in adults. Just 2-3 points of simple clarity here. A, we don't know if the second mutation, that is the third wave virus, is going to be more deadly than the second wave or less deadly than the second wave. So we don't know the intensity of the wave. Now, no one can predict that the next mutation is going to be more deadly than the previous mutation. Number one. Number two, we don't know when it's going to come. We hope and pray it takes a little longer time to come. By the time 70 to 80% of our parents are immunized, and some start in the immunization of pediatrics also starts, which helps us protect the children. Above 12 are being vaccinated abroad. Hopefully that comes down fast. Covaxin is in phase 3 trials for younger children. Hopefully that rolls out fast. So we are praying that the third wave takes a little more time, gives us a little more time to prepare our children, for us to be prepared, because just in case we need to accompany our children to the hospital, they can't be left alone. So we better get immunized and be prepared. So praying that preparation in mind. Thirdly, giving us as pediatricians enough time to make pediatric infrastructure, keeping it ready, which let me remind you, it's completely different from what it is in adults. Adults, you can isolate. Adults have constructed ready ICUs and ventilators, ready imported. Nobody has imported pediatric intensive care apparatus. Nobody has imported pediatric ventilators. Nobody has created pediatric ICUs, which are not there in our country. So that's what's happened. Last 10 days, there are a lot of task force set up amongst pediatricians across the country, preparing for a third wave in every which way. If and when it comes, we are going to be prepared. So I would request every parent to not panic about the third wave, because there are a lot of ifs and buts about the third wave yet. Number two, I would request every parent to take that fear about their child succumbing or getting infected to the third wave, use that fear and get yourself vaccinated. So just in case our children need us, we are ready for them, to accompany them, to be there by their side without the fear of us getting infected. So this is the current status. I'm going to have it over to you, Vishal, again, but I want to just send out a message there that we've done good. We have things in control, and we're going to make sure we keep it that way. So let's keep our hopes up.
That was a fantastic opening remark, Dr. Parekh, and I think you touched upon all the aspects. I think we are having a few questions coming up from the audiences, but before we take that, I just wanted you to touch upon one very important thing, which is around vaccination. Currently, India is facing massive shortage of vaccine for adults. You know the situation out there. It is very difficult to get vaccinated. And right now, given the time frame, one of the real reason for worry is that they are saying, hey, while adults may or may not get vaccines, the kids will be completely unprotected when it comes to the next wave. So what are your thoughts around adults getting vaccinated and kids not getting vaccinated? And how soon do you think, if at all vaccines are available for kids, how soon do you think we should go and get our kids vaccinated?
So, Vishal, it's a very good point that you brought up. See, the current scenario, I would, want to place all my faith in my government, that they are doing what it takes to get the vaccine to the adults as soon as possible, as much as possible. I think they are considering opening all doors to all brands so that, more and more people get vaccinated. People should also remember that a single shot is always better than no shot. So before you think about, oh, this will require 2 shots and I don't want to wait for 6 months and 3 months and I want to wait for this one, at least take one. Get yourself out of harm's way, because one will still prevent you from dying. So that is what every parent should keep in mind. When it comes to vaccinating children, there is a big difference amongst the hurry to vaccinate adults as to the hurry to vaccinate children. Now, why? Let me just explain that for a minute. We are and we were, and we still are, again, in a hurry to vaccinate adults. Why? A, we need 60% of the adults vaccinated to throw the disease out of the country. That is the herd immunity. So we need them, that quota, to get ticked. Number two, this disease in the second wave has been fatal for adults of our age, is actually taking lives. And every shot of vaccine, it is a proven fact. A lot of people from personal experience may not completely agree, but as per medical terminology and the data we have, that if you manage to take 2 shots of a vaccine, it's 100% guarantee that you will not die, 100%, that you will not reach the ICU and you will not die. It is a 70 to 80% guarantee that you will not get the disease, to that extent that you may have to go to the hospital. It's a 40 to 50% guarantee that you will never get the disease. So I want to clarify that the vaccine doesn't prevent the virus from entering the person's body, but it prevents and modifies how your body will react to the virus. So it is 100% going to protect death. Now, in children, getting to immunization in children, why I want to be doubly skeptical. Number one, safety of these vaccines in children, they may have data for short-term safety, meaning you gave the vaccine, nothing happened within 2 to 3 months, 6 months safe. But to gather data in children and in adults over long-term complications, 15 years down the line, 20 years down the line. Now, an average adult taking the vaccine, right, if you're 40, 45, what happens to us at 60, 65? We are worried, but not that much. We have lived our lives. If our children get some complication 20 years down the road, they will be in the peak and prime of their life, and we don't want them suffering with artery blocks and problems because of the vaccine which was given 20 years ago. So before I vaccinate or propagate vaccination in my patients and in children, I want to be doubly, triply sure that the company has done good enough research to vaccinate. And the company which has done maximum research as of now and I'm confident in advocating, is Pfizer above 12. Unfortunately, it's not come here yet, but when it comes, that would be the point to start. My last point is, this second wave, even though with the deadliest form of the virus, has not caused death in children. So we are merely protecting diseases which are lasting for maximum 3 to 5 days by vaccinating our children. So the concept of any vaccine is to prevent morbidity long term or decrease mortality. Currently, COVID in its craziest and the deadliest form has still not caused enough morbidity and mortality for me to tell every parent that tomorrow take the vaccine for your child. So I'm going to hold on. I'm pro-vaccine, but I'm going to do my due diligence before I go gaga over straight vaccinate your child.
Data, right? The kids have been the smallest population who have got vaccinated. So let's get more data. Like we already are seeing the data of adults from other parts of the world. So kids
Right.
aa jayega. And Jasleen has a good question, right? That till the time kids are not vaccinated, is mask sufficient? Can they just, because kids have to play, right? They can't be locked at home. But if kids have to play, they have to go out. What can they do? What precautions can they practice?
Okay. I think it's a good question. And I've been harping on this point since the last 6 months. There are only two things that you have against the disease to protect yourself and your children. Number one is vaccine as and when it comes. But till then, the only weapon we have is masking. So the only, and what if you want to take it to a whole new level, the only thing we have is WMD. Not weapons of mass destruction, but wearing masks, maintaining social distancing, and washing hands. So that's what we follow. Till that time,
distancing is a problem. That's the challenge, right? Kids are not, they fight and they are playing in the mud.
So there is a new pandemic of mental health that we are seeing in our patients. A pandemic of aggression in children less than 10 years of age, and a pandemic of, for lack of a better word, depression in children about 10 to 12 years of age. So the pandemic of aggression in children is from 4 years to 10 years of age, where because of inability of channels to disperse their energy in the right form, either in the playground, either at a friend's house, either playing a contact sport, football, tennis, which has been deprived from them, all that energy is coming out at home in form of biting, hitting, screaming, shouting. I know it's most heartfelt, but I need the parents to hang on for just a few more months. I know they are tired. I know they're exhausted, but they need to continue masking. They need to keep their children indoors because children are still infecting children. You don't want them to fall sick. And I don't want your kid getting infected, bringing that infection home and spreading infection in the adults of the family. So I want them to be, so when it comes to masking, children under 2 years, you cannot mask as by WHO. From 3 years to 5 to 6 years is your 2-layer cloth masks, which cover the nose and under the chin, elastic, good fit. Above 6-7 years, N95s are recommended. So yes, as per that lady's question, I'm really sorry, but we got to continue what we're doing. There is no shortcut out of this till the vaccine comes.
I think there are also quite a few questions around multivitamins and, what can be given. And I know you were talking a lot about vitamin D also. So especially apart from masks, as a parent, I know everybody is giving them, kada and turmeric milk and all of those things. But are there any scientifically proven things which parents can do from a defense perspective?
So I'll tell you, from defense perspective, the only thing, there's none of these that can prevent the disease. Let me be very clear. The only thing that can prevent the disease is preventing the virus from entering your system, hence the mask and social distancing. But unfortunately, if and when the virus does enter the disease, if your child has adequate levels of vitamin D, it does help in reducing the severity of the disease. And the zinc and vitamin C given after 4th or 5th day of the onset of the disease does help in faster recovery of your child from the disease and has shown to play significant advantage in reducing the length of the disease and post-COVID complications in children. So vitamin D on regular basis to prevent the disease, vitamin C and zinc given at the right time in the second or few days after there's the onset of the disease for quicker recovery. But again, these are all Vishal medications. They're dose dependent, they're age dependent. They're not the same dose that every adult keeps popping a pill. I tell you as a friend, you tell your friend, and he tells his friend, "Arey, ye lo, ye lo." not in children. Hypervitaminosis D is a known complication. Increasing vitamin D load on the kidney, calcium load on the kidney can create stones in the kidney at an early age. So go by your pediatrician's knowledge. These are all medications, and your children's bodies are sensitive. Do the right thing with the proper dosage. And yes, these three things are known to help: vitamin D, zinc, and vitamin C.
You also talked about mental health, and Chaya Shah has a very pertinent question that for the first time, kids have seen so much death and so much misery around, when they have seen relatives or even television or even social media, right? Kids are all seeing all this happening, and kids are getting extremely anxious, seeing their grandparents suffer. And overall, there is a impact on their own mentality. Some of them are becoming too scared themselves, right? So what talk can parents all this things happening around to give them the confidence and the boost?
So it's a good question, and this usually, is more pertinent for children above 6 years and 7 years of age who can understand. I have to first warn every parent to be smart enough to pick up signs that the child's mental health is a little bit in trouble. Children from 6 years onwards are currently manifesting a lot of aggression, like we spoke about. But about 9 years, they're manifesting. Look out for your child if your child suddenly is sleeping more or suddenly not sleeping at all. Look out for your child's complete loss of appetite or suddenly eating a lot. Look out for your child's behavior, which is emotionally very liable, fragile, starts crying at a drop of a hat for no apparent reason, gets affected even if you just scold her a little or him a little, cries which she or he who used to scream back and never cry. So these are red flags where you need to pick up the phone and talk to your pediatrician or your counselor. There is no harm in getting help. Get help. These are unprecedented situations. Nobody has been trained to handle this. Not the kids, not the parents, not even the doctors. So we are also working day in and day out to make sure we set certain protocols. But to prevent this, keep COVID bad news away from your children. Don't make it the only discussion you have with your child. Keep death tolls away. Keep talking about constant number of people who got infected, hospitalized, your uncles, your aunties. Don't let that be the only discussion. Yes, inform them, but don't be the bearer of bad news all the time. Have a very well-structured day from morning to evening for kids under 8 years of age, so that there is no time for all this nonsense. Where the day starts and the day ends, the kid doesn't realize. It's a well-planned, and by the time it's 9:30, the kid is so tired, just goes off to sleep. Second, keep a lookout for a lot of psychosomatic symptoms. We are seeing a lot of kids coming to our clinic not with complaints of mental health, but uncontrolled headache with no underlying cause, recurrent stomach aches, loose motions, irritable bowels, waking up in the middle of the night with cold sweat. So these are panic attacks that we are seeing in children as young as 8 and 9 years. It's shocking. It's shocking. But this is the severity of the situation. So A, for elder children, look out for red flags. B, keep all your lines of communication. Befriend your teenage preteen. Befriend. You are not having your friends. Make them your friends. They need you. You need them. Open your channels of communication. Even if they're not talking, go to his room every evening. Okay, I'm going to sit here till you don't talk to me how you feel. Sit there for 15 minutes. Eventually, they will give up. They will open up. And once they open up, it's really going to make them happier kids and you happier parents.
There are a number of questions related to newborn kids. There are a lot of lactating mothers who are still breastfeeding the kids. There is this whole, because when a kid, kids a little older who can at least talk and communicate, but infants right now are also are getting infected, or they have parents who are infected. So do you have any special do's and don'ts for infants, especially, let's say, newborn kids, let's say under the age of 1 or 2, or whatever you consider as infant?
So under 1 year is usually considered as infant, you're right. COVID in children less than 9 months of age and less than 1 year of age is still very rare. There are certain receptors called ACE2 receptors where the virus attaches itself to enter the human body. Those receptors are very low in number or don't exist in children less than 9 months and are very negligible. So the chance of the disease in children less than 9 months to a year is very less. If there is a breastfeeding mother who's infected, if she has mild symptoms, we strongly encourage the mother to breastfeed the child with the N95 mask on. She can take all possible medicines except antivirals. Once she starts antivirals like Fabiflu and stuff, then breastfeeding needs to stop.
The virus cannot transfer through milk or anything.
No, the only thing that can transfer through the milk is the antibodies which will protect your infant if you are infected. So continue breastfeeding your infant if you are infected. Continue breastfeeding if you've just taken the vaccine. You can breastfeed before the vaccine, during the vaccine, and after the vaccine. So please don't stop breastfeeding. And if you're sick enough to go to the hospital as a mother infected, there is no way you're going to breastfeed any which ways. But if you are at home, you can still continue to breastfeed even though you're infected with the mask on.
I think there's another, very important question. A lot of people already have kids who have got infected in this wave, who have recovered or who are still infected. So is there any different protocol for kids when it comes to COVID recovery? And long COVID is this new phenomenon we're all talking about. Are kids also suffering from long COVID? What can parents do if they currently have kids at home who are infected, or if they are infected and they have kids at home, and the post-COVID treatment protocol for them?
So fortunately, Vishal, like I said, the treatment of, what we call as a regular treatment of symptomatic treatment, that is antacids and decongestants and plenty of liquids orally. Sometimes we add azithromycin because slight immunomodulating properties of azithromycin have helped in children for faster recovery. So those are basic medicines we treat, and they all respond very well, except that few 2 to 3% that require a few drips because of dehydration. But otherwise, they recover very well. In kids after recovery, under 8 years, they do have slight prolonged symptoms like stomachache and loose motions, but their energy itself is good enough and you won't even realize that they've recovered. But kids above 8 and 9, we've seen at least 30% of them have something called long COVID. I'm very impressed that you use that term. It's a significant medical term that has been labeled as the long COVID syndrome, where post-recovery symptoms of headache, mild fever, body ache, loss of enthusiasm, loss of memory, what we call as cloudiness of the mind, cramps in the stomach, loose motions can go on for up to 2 to 3 months, which is known as the long COVID syndrome. But the good part is it does not cause fibrosis in lungs like it does in adults. So the day-to-day activity, the long-term prognosis of lungs and heart and all is not something to worry about. So maximum what we see is up to 2 months.
So let us say kids are admitted to the hospital. So there are a number of doctors here also who are asking that are there any special ways to handle kids in, let's say if the general wards itself will have to admit kids. Let's assume that the worst case scenario comes true. Is there any separate protocol for it? What can be done? Similarly, you can't keep kids in isolation. The whole point is that you can put adults in an isolated room or send them to isolation centers. Given that, mother or somebody will have to accompany a kid. And what if the parents are not vaccinated? So there are a number of permutation combinations over here of how do you take care of kids, what is their isolation protocol, hospitalization protocol, and will attendance be allowed in hospital? Because normal COVID ward, nobody else can come in. Adults are fine, but kids ward how will that be handled? So there are a number of questions around this. So I hope you can cover that. Our questions are just endless. So
So let me start by saying that I think it was last Sunday we had a big meeting with our chief minister with the top senior pediatricians. We made protocols, divided approach to children with mild, moderate, and severe COVID. Decided on infrastructure, primary approach centers, fever wards, COVID wards, non-COVID wards, which test to do in the casualty so that we can decide whether he goes into a COVID ward or she goes into a non-COVID ward. Encourage mothers giving their children flu shots. Flu shots, I just want to take this time. The whole purpose has been a little bit of misconstrued here because we've been getting a lot of queries after it came out in the paper after that meeting that flu shots are necessary and they're going to prevent against COVID. Let me make it very clear that flu shot does not prevent against COVID in children. It will reduce the confusion between COVID and flu if and when the third wave comes because both the symptoms are the same. So if you give the COVID shot and the number of flu cases reduce, then you know that you're looking more at the COVID cases. So the confusion and the load in the hospitals and on the pediatric clinics will be lesser. Hence the encouragement to give that additional flu shot. When a child gets COVID, most of the treatment will happen at home in the isolation we just discussed with the parent. At all times, we will encourage to keep the grandparents away. Whether they're vaccinated or not vaccinated doesn't make a difference. They still, bear the maximum chance to get most affected. So we keep them away. The healthier parent will take charge. One parent will be allowed with the child in the COVID ward to sit by their bedside. The number of days of isolation may be reduced because the viral shedding in children is not as much as in adults. What was 14 days of isolation may be brought down to 7 to 10 days. Intensive care also, we will allow every parent. We may do RT-PCR, but we will need the parent to have had both the shots with the certificate. That's going to be a standard rule. So again, encouraging every parent out there that if they are worried for their children in the third wave, first get your shots, because we will not be able to keep your child alone. So there are norms made, there are SOPs set.
Different equipment or same equipment can be used, because there is this whole question ki ye sab hamare paas hai ki nahi itne equipment.
Yes. So luckily, if the third wave follows the same trend as the second wave of very low number of severe cases requiring intensive care, we have enough setup. The government of Maharashtra, big companies like Reliance are setting up as of date, as of today, COVID wards for children, COVID hospitals for children, and COVID intensive care setups for children, and ICU protocols for pediatrician to follow to manage. So we are very well prepared now. We are getting there. We are almost 80% there in form of infrastructure, in form of SOPs, and knowing what to do and when to screen for. So I want parents to stay calm. We've got it under control, but their help will be needed. So please get your shots.
And is there a difference? There was an interesting question. You talked about the flu vaccine. Similarly, is the vaccine which is given to kids a different version of the vaccine? Do they still get the 2 doses? What is the protocol around, especially outside India, wherever kids have been given?
So the flu vaccine per se has come into the picture maybe around 6, 7, 10 years ago, but now suddenly it's got the spotlight because of the COVID, where all children. So normally we do recommend flu shots in every child up to 5 years of age, even in our country. It's not a part of the government protocol because of the affordability, but in every private clinic, the first vaccines are given as early as 6 months of age, 7 months of age. And then there's a yearly flu shot given at 2 years, 3 years, 4 years, and 5 years. Above 5 years, we give flu shots only in children who have compromised immunity, like a weak lung, like a congenital heart disease, like a fibrotic lung, wheezers requiring pumps even after 5 to 6 years of age, nebulizers. So those are given up to 8 and 10 years of age. On immunosuppressant cancer patients. So these are given till 10 years. But above 10 years, we never used to give flu shots in children. Flu allergies, flus are different. West is more prone to allergies. We are more prone to infection. The southern hemisphere virus is different from the northern hemisphere flu virus. So their vaccines are different from our virus. So our vaccines are different. But the immune, now even when COVID first came, everybody said that, we'll get less affected because we have good immunity. Now that may not have stood the test of time for COVID, but in flu, it has worked. Because of our children's continuous exposure to close proximity to sick children, mixing of societies, high rises and slums being in the same area, kids playing together in school, most of the children develop flu immunity by 3 and 4 years of age. So even if you skip the shot here and there, you will never have a child dying of flu or going to an ICU because of flu. So we have good exposure at a young age, hence good immunity, hence not that much emphasis on the flu shot.
Also, apart from high temperature, the whole, especially for adults, there was this discussion around check your SpO2, check your oxygen level, and this is below, this is the problem, So are there similar, anything same, what can a parent test? A lot of times kids don't report their symptoms, right?
Correct.
What is happening? So is there, apart from temperature, what are the other things one should test for their kids?
90 to 90% of the presenting symptoms have to be related with fever. So we use it as a screening tool. If the child doesn't have fever, we don't even go down the COVID road in children, because otherwise it sets up unnecessary panic, because every second child complains of a throat ache, stomach ache, loose motions, earache. If it's not with fever, we throw COVID out of the window. But if it's with fever and the child is above 6 and 7 years of age, and the fever has lasted more than 5 days and started with a cough, that's when we ask them to start monitoring. Under 7-8 years, the monitors are not good enough unless you make special ones for children. That's another thing altogether. But there are monitors which are currently used, which are only for kids above 7 and 8 years of age. Children's heart rates become adult heart rates by 7 and 8 years of age. Under that, they're always higher. So many a times when you take your child's heart rate in fever, you will get 130, 140, and you will set yourself in a panic blaze. It's normal. Wait for the fever to come down. You will still see the heart rate come to 80, 90, which in our case should be 60, 70. In their case, 80, 90 is normal. So heart rate is age appropriate, age adjusted in children, starts at a very high rate at a young age and keeps going down, beats the adult's heart rate by 8 and 9 years of age. So start maintaining saturation by 8 and 9 years of age. And lastly, I want to say adult COVID and pediatric COVID, one main difference is pediatric COVID is a single phase disease. Adult COVID is a biphase disease. Single phase means fever comes, goes, children are through. Adult means fever comes, goes, settles for a few days, inflammatory phase starts. Chest gets filling up, 6th or 7th day. Saturation drops. So in children, we are not seeing the second phase. Hence, the requirement of saturation monitoring is not that acute.
But I think that's the whole thesis of the wave 3 is कि ये kids में हो सकता है, right? It started, wave 1 started that nothing is happening to kids.
Correct.
Wave 2 was kids are getting infected. So I think, now what has happened is we took wave 2 so lightly as a country. Now everybody is hyper paranoid about wave 3. So I think, and given that the number of questions we are getting here, right, it is quite obvious that, everybody has so many questions related to their kids. And again, the questions are all around immunity, immunization, vaccination. But there was another interesting question, which I thought would be very good, that you talked about the Pfizer vaccine and the clinical study. Is there any report on Pfizer which is not effective against strains found in India? So they are also now thinking that Pfizer vaccine is working on kids in America. What happens to Indian, we are now talking about the Delta, the COVID Delta virus, what the strain.
B1617.3.
Delta now by WHO.
Yeah.
They are not calling it the Indian virus. It was never the Indian virus. It was
correct.
Delta is what now they are referring to. So for Delta, do you really think Pfizer and other things are going to work? Because parents are very, very worried about it.
See, let me make it very clear. You cannot make a vaccine to cover every strain because this is a very fast mutating virus. Flu virus mutates once or twice a year. We can manage to change the vaccine or add that strain in the vaccine the next year when we make that new batch of shot. But this COVID virus has changed forms so many times in the last 6 months to a year. It's impossible to make a new batch every time for a new mutation. But one thing has been proven, that if these vaccines cover 60 to 70% of the primary strains, they do give partial immunity up to 50 to 60% against the other mutations as well. So I would go to the extra mile and say, yes, once you take a good quality vaccine, you will get a very good protection against 60 to 70% of the strains. And not so bad protection enough to prevent your child or you going to the hospital against the other mutating strains. So keep that in mind. And I would still say it is the best bet we've got.
It's interesting, right? As kids, the first time you get a vaccine, that when you are a few months old, few weeks old actually, and you get through all your vaccination by the time you're age 2. And most parents don't even know the names of those vaccines. But today, suddenly, everybody is worried about which brand, which vaccine, which efficacy, which strain. So why do you see this big difference of first not even caring about what a lot of parents even missed vaccination dates? If I have not, a lot of them, you have to keep reminding them, right?
Absolutely. And now they're here before the date comes. We have to tell them, come back later. You still have time. So I'll give you a very classical, on a slightly lighter note. Recently I go for home visits, and I went to a person's home visit, and the watchman, as protocol driven, took my temperature and saturation and thermometer. He put it across. They are not allowed to put here, now here. And he said, sir, aap jao upar. Aapka temperature 92 or heart rate 81 hai. Saturation. Number one, he said, look, first time doctor saturation is being taken by a watchman and the other way around. And number two, he doesn't know any basic fundamental, because he's letting me go up with a saturation of 81 and a heart rate of 52, which means I'll be cold supposed to be dying on the side. So what has happened here is we are just given rules to everybody and expecting them to follow it without reasoning. Same is also happening in the educated class, where they are just grabbing the headlines from the WhatsApp university, grabbing the headlines from the news and the flashing sort of breaking news, and not going into the details of the explanation. Now, I don't blame the parent, because they're anyway so on edge that any such things will put them across on edge. So I need every parent to take the whole news, sit down, read it, talk to a reliable source, in this case usually the doctor, see if it's correct, and then help spreading the word. We are very happy if you spread the right information. It makes our job less toxic. So we really want your help, but spread the right news.
No, clearly, right, there is so much misinformation around vaccines. Also, recently we know the entire medical community was up in arms against what was being talked about, against the medicines itself not working. So is there any kind of medicine which is not effective on kids, or is there any kind of protocol or treatment or steroids used? Because black fungus was such a big discussion area. So can kids get black fungus? So all these questions which were currently being talked in the context of adults, everybody is 10 times more worried about black fungus in children.
So you realize that all this came about because of the virus being very aggressive. Because the virus was aggressive, younger people were given steroids much earlier in the day. Because they were given steroids much earlier in the day, those borderline diabetics became diabetics. Because they were suffering more, they were put on unhealthy or unclean oxygen much earlier. So a combination of high sugar, depressed immunity because of the strong virus, and unhygienic oxygen spread the black fungus, caused complications like this. Plus, rampant use of unprescribed medication. I know friends who have prescribed each other's prescriptions on WhatsApp. So that is something we cannot afford to have in children.
Even on national news right now.
Yes, absolutely. Exactly, yes. So we cannot do that in children. Hence, we are advocating in children, lesser the meds, the better. Intensive care is the only time pulse methylprednisolone, high doses of steroids, IVIGs, and such medicines will be given only if your child is sick enough to be in the intensive care. So I am very confidently telling every parent right now, no matter how bad the third wave is in your children, medicines are going to be very, very clearly, slowly, gradually, and properly given after due research, because we've seen the harmful effects of over-medicating than under-medicating.
So what are the trusted sources, right, for kids? The problem right now is that adults ke liye pehle trusted source nahi tha. There are, in fact, you are among the few voices of, credible voices who talk about kids' health. So where can people get information? Is there any website or any books or any, of course, this video everybody should be seeing, but is there anything else which people can do?
So I think talking to their pediatrician is most important, because you have to realize that, every doctor is also learning the disease. Adult physician learned a lot about the disease last year. Pediatrician are learning a lot about the disease this year. So as we learn, we discuss. There are global platforms, global forums, SOPs made, task forces set up that come up with protocols, approaches. All the medications are the same, but their use has been very, very restricted in children to very, very severe cases because of the side effects, because these medicines are very strong. They will do much more harm long-term, short-term in children if given without proper indications, if not given at the right time. So for a parent to try and stock up medications for their children or consider using medications in the future, if remdesivir is not available, it will not come to that, because in children, their usability is going to come down to very, very few cases, which are the severest form. And I'm sure when it comes to our kids, we will go all out in procuring whatever is required whenever it's required. So I don't want the parents to stress about that right now.
Kids are missing, a lot of kids might be missing their regular vaccination, right? Because of lockdowns and parents didn't want to take. So is there any recommendation, or can they take it later? Is there any outer date for, if
they should have gone yesterday. So don't miss a single shot. because these are the only vaccines that you have against preventable disease, which will save your child's life when the immunity drops because of COVID virus. These are the first ones to attack your child's lungs. These are the first one to attack your child's stomachs and brains. So make sure you give these, because they will be life-saving even more so during COVID times. So don't miss. You've already delayed. I know a lot of parents were being cautious, and rightly so, last year. But this is not the time to waste, because if and when the third wave hits, we want them fully immunized, at least against the preventable causes of death.
So Hari has asked an interesting question, and I know everybody wants to know this, that will the COVID vaccine become an annual phenomenon? Will this become, and even for kids, will we have to like software or like our phones keep upgrading the vaccine every year?
My gut feeling is yes, for the next 3 to 5 years, it will. It will.
So till the time the virus mutates into something which is completely weak and gone, I think
absolutely. Till it has the potential of causing a disease, we will have to continue annual shots.
Yeah, but I think, overall, the light at the end of the tunnel is great that with India, vaccines are coming. I know that between Sputnik and all these other vaccine shots, a lot of vaccination is coming. A lot of parents are right now even thinking of saying that I'm willing to travel abroad. I'm willing to travel to anywhere else to get my kids vaccinated. What is your message to parents who are in a dying hurry for getting their kids vaccinated, versus how soon can these vaccines come in India?
So above 12 is a big drive in Dubai and in US right now. I think parents who are there, they call me, should I? I said, yes, if you're there, please go ahead and do it. But don't make special trips specifically just for the immunization. We have a lot of kids who need to get into universities. They're going there anyway. They need certain, so that's going to be a given that yes, if it's the need of the hour and your education is going to suffer and things are going to lag behind, then go take the shot anyway you're going there. But just to plan a trip to take the vaccine, you're putting your child in a lot of harm's way during travel. The wave is not out completely eradicated yet, even in foreign countries. So don't wait for it. Let another month or two go by. We are not, as India, we are not that far behind. Trust me, like you mentioned, with our government being so pro-vaccination and opening up floodgates to international vaccines, it is a matter of weeks to months till all these are available for our children. Let's do it the right way. Let's not get over paranoid and do things which are not recommended by your country or by your state.
Well, I think that's an important point, right? By hurrying, you may put more harm, or, because it's good to see the data. I think it's quite clear vaccines are working. US is almost opened up. UK is opening up. So countries where vaccination has reached a mass scale, we are seeing that they are actually successfully, even in certain cases, they are saying you don't need a mask. So I think, hopefully India will soon reach that space. We have a 1.3 billion population. So a huge amount of these people need vaccinated, but kids who are our future, right? That's really what we are all spending our life, and as parents, we are doing this. I think it's really important. I think, again, we have gone through a lot of questions, Doctor. It was really, really amazing to hear your views and your clear-cut direction, right? A lot of times we are confused. So I just want to quickly summarize what you said, and I would love for you to add. Your message is very clear that kids, while they are at risk, most probably they will be through the first phase, which is the high fever phase, which you have identified. Unlike adults, where the phase can go post high fever itself. So in most of your cases, or most cases, we have seen
across the world, I would say up to 95%. So, the rare complication of MISC, which is an inflammatory response of the body post-COVID in children, which is a multisystemic inflammatory syndrome, is a little bit of a worry, but like the numbers are bare minimum. So when someone talks about MISC, I just tell them, please don't spread the word. We as practicing pediatricians can count cases on our fingertips over the last 6 months, and all are doing well. So you're spot on. It's not that drastic in children.
Your kids, 95 to 98%, it'll be fine. Now, if your kid has some underlying health issues, asthma or anything else, then maximum they may need isolation. And for isolation, the protocol is very clear that parent can accompany the kid. If at all they are in external isolation, most probably you can isolate your kid in your own home without a problem. And even while you're isolating, you don't have to lock them in a room. You can be with a mask, and you need to follow the protocol of wearing a mask. And kids above the age of 18 months should be wearing masks. Anything lower,
Above 2, still 18 months, they are breathing. Above 2 is safe enough.
2 years and below, kids should not be wearing masks. About two, kids can be wearing mask. The treatment protocol for kids should not be very aggressive. Please do not look at all these complicated name medicines, ivermectin and remdesivir. I mean, these are all such tongue twisting words. So
Correct,
you
correct.
can't pronounce the name of this medicine. It should not
Yes.
be given to your kid. The only medicine could possibly be Dolo or Crocin, and that too one
Paracetamol. Paracetamol is the
all
simplest.
really going to be a large. So, unlike Fabi flu, I mean, the problem is a lot of people were popping a lot of steroids and all kinds of medication and even blood thinners and, all kinds. So, for kids, clearly that is not the way. So, do not do any aggressive treatment for kids. In case there is the rare chance that the kid does require hospitalization, protocols are in place, not only in Maharashtra, but across the country. Doctors are getting prepared for this. And I think, let's assume that the government will be prepared this time, given the amount of discussion which is happening around it. And also post COVID, while long COVID is there, it is again much lower in kids. And again, it is something which is going to be treatable and manageable itself, because kids in themselves have a much, because they're growing at the same time. Also, you talked about one very important thing, that young kids, newborns, don't have ACE receptors. So while again there is a rare chance for everything, but in their case, a newborn getting COVID is rare.
A vertical transmission from an infected mother to a child is possible because that comes through the placenta. But the mother giving it through a cough and cold is still a possibility, but lesser, because even though the virus comes into the child's, the newborn's nose, there's no place for it to attach because of the absence of receptors.
Exactly. So I think for kids, you also then talk specifically about kids' mental health. I think you are seeing a lot of aggression. You are seeing signs of mild depression. You are seeing loneliness. Kids are unable to go to school. They don't have a social circle. So there is a lot of pent up, their energies normally get expanded when they are traveling to school. They're running around. They can't do that. So you need to, as parents, make special efforts to spend more time with the kids and kind of do that. I think you also touched upon a very important topic of vaccination. Whether you are pregnant, whether you are delivered a kid, whether you are on the way to deliver a kid, please take vaccination now. WHO and everybody has opened it up for everyone. Previously there was
Correct.
some restriction for pregnant women, but clearly this is now opened up, and it's not a problem at all. And in fact, antibodies can be transferred from the mother to the kid by breastfeeding. So actually, it's a good thing if you are breastfeeding, even if you are infected or recovered from there, because you are actually going to be giving the antibodies, uh,
Passive immunity.
passive immunity, which is a very important aspect. You also talked about not rushing into any vaccine, and not at all traveling outside of India to or anywhere else to get a jab, because clearly India will get the vaccine. But let's look at more data, because in
Correct.
kids, the side effects or the any kind of adverse effects are still not yet known. So by the time in the next few months, we are hoping that millions of kids outside of India will be already vaccinated.
For a
And
change, they have become our guinea pigs. So
exactly, normally it's the other way
it's the other
around.
way around. Yeah.
Clinical trials are done in India and other
Yeah.
countries, and then the
Yeah.
West gets the medicine. This is actually for the first time where the West is becoming the. It's
Yes.
a very interesting way of looking at this. It's the West which is becoming the guinea pig for the rest of the world, for us to see what's happening with them. So I think it's better to wait rather than doing. Also, from a preventive perspective, you talked about vitamin D. Of course, don't overdo vitamin D, because vitamin toxicity is also a challenge. You've also talked about making sure that on an overall basis, kids are active, you are playing with them. I think we have pretty much covered it all. I don't know if there are any concluding remarks you want to give, doctors, and then we can conclude this session. Thanks a lot, everybody. I know there are more questions, and you can always tweet these questions to us on the India Shield on Facebook, Twitter, etc. And even Dr. Nihar is available on various social media platforms. You can also follow him and also get first-hand information.
So, Vishal, I don't think I could myself have done a better job summarizing this entire 1 hour session. I don't think you've missed anything in the entire summary. So I think you've done a brilliant job summarizing. There's not much to add. But again, I want to reiterate the fact that number one, parents, please get vaccinated. Don't be picky. Don't be choosy. Don't be, I want to wait for this one. I don't want to give this one. I want to take Pfizer. I want to wait Sputnik. Take what you get. Take it as soon as you get. Because as parents, if your children need you in the third wave, you cannot be unvaccinated at that time. You won't be able to spend time with them. Number two, we don't know much about the third wave, when it's going to come, how it's going to come, whether it's going to be more severe than the second wave for our kids. But all we know is that we are going to be prepared. We're going to keep you prepared. We're going to keep you posted with such kind of information so that you don't press the panic button unnecessarily and have sleepless nights. So again, thank you so much, Vishal. This is a brilliant opportunity for us to spread the word.
Thanks a lot, everybody, and be safe. Thank you.